Marewa, what would you see as the key takeaway for you personally from this report?
Sweden is the leader in adopting a harm reduction approach rather than demonizing non-pharmaceutical, non-tobacco nicotine products. But it's not just a Swedish phenomenon. New Zealand has achieved similar rapid reductions in smoking, but with vaping. And like Sweden, New Zealand has experienced a surge in women's quit rates. And not just women, we have also seen a rapid decline among our low-income adults as well. And that's going to reduce inequities, which is a major challenge for global public health. So, and youth. I should mention 18 to 24-year-olds have conventionally been the ones with the highest smoking prevalence rates. In New Zealand, they are no longer the group with the highest smoking prevalence rates. So it's just been an absolute game changer.
Marewa, is the voice of females heard, recognized, and respected in public health? And if not, why not? And how can that be changed?
In New Zealand, because of the high smoking prevalence among women and men, it was really equal. But the health effects are not equal. So we did have high rates of smoking among pregnant women. Something had to be done that was specifically effective for pregnant women to help them stop smoking while pregnant, but stop smoking within their parent. So we've definitely had a lot of tailored approaches to different demographic groups, and that is needed. You do need to work out what's effective for each demographic group. Yes, women have been at the forefront of advocating for the right to access what is a life-saving option. And that's what they say. This is a life-saving.
What message would you have with women? Would you give to women who are struggling to quit smoking, maybe even globally, and some have access to alternatives and others don't?
I think that for anyone who smokes, it is about finding a product that works for them within the context of their lives. And I mean, that's really a principle of harm reduction. Whatever harm reduction is being used for. So it might be risky driving or risky alcohol use or, some other drug use. So it's about working with the person, respecting that they know best what will work for them within the context of their lives. And that's different for different people. So again, having a range of products that are affordable, as we do in New Zealand. So there's no tax on vaping products. We needed it to be accessible for the lower income groups where smoking prevalence is the highest. It just, with income, it's just the lower income, the higher the smoking prevalence rate. So tailoring approaches, cessation approaches as well. Not everybody is going to feel comfortable, say, talking to somebody on a quit line. So we have on the ground personal support available for free.
So, Marewa, do you see oral nicotine pouches as compatible with traditional smoking cessation methods, whether it's the stages model or whether it's the 5A model of WHO? Do you think that oral nicotine pouches are compatible with these methods? And if so, how?
I think that having safer nicotine products available as a consumer product is far more effective than the conventional smoking cessation theories and practice. Somebody isn't required to make their way across town somehow, go see somebody in a clinic and be condescended to. That's what they tell me. They feel condescended to. They're being told to do this, and rather than working with them. And this consumer model where they retain power over their choice is far more effective, has reached far more people. Millions of people we know have switched to a reduced risk product.
Would you say that oral nicotine pouches are well received in New Zealand? Do you see a place in New Zealand specifically for oral nicotine pouches?
Oral nicotine pouches entered the market at the same time that vaping did, and people were switching to oral nicotine pouches. So it was a great shame that oral nicotine pouches were banned in New Zealand. At the time, they decided, no, we're only going to back one. We're going to try one method. And that isn't what works. People are not all the same and they have different needs.